Alrighty, so we're going to move on to the exciting Clinician of the Year. Well, this is our Clinician of the Year at age 3, a handsome baby, but a baby. And I don't see any indication here of the heights to which this gentleman would rise in plastic surgery in the ensuing years. Move on to here we are, Clinician of the Year at age 6. At his ranch, his family ranch in Austin. This is his uncle on his right. And now I think we're starting to see the determination and the fire in this man's belly. I think the horse is a little big for him, okay? And looks like he's going to have to grow into those stirrups. Grow into those stirrups, he did do. And here is our Clinician of the Year, a lanky center fielder for Austin High School, all-conference center fielder. In fact, was offered a contract, professional contract by the St. Louis Cardinals. Lucky for plastic surgery and lucky for craniofacial surgery that he turned it down. And I hope I didn't give things away. Here our Clinician of the Year is in 1963 as a captain in the U.S. Army stationed in Germany. And this is where he first developed his avocation, serious avocation for wine. So here he is in his Austin Healey with his wife Renata in the wine country in Germany. And this became, as I said, a serious avocation. The beginnings of craniofacial surgery at Children's Hospital and HUP in 1972. And in case you can't recognize some of these people on the far right is a young Peter Randall. Of course, in the center is the grandfather of craniofacial surgery. And then to the far left is our Clinician of the Year. So these first generation of craniofacial surgeons, their fellowship really was to travel to Paris to watch Paul Tessier operate. So they would go and watch these very long 14, 15-hour operations, combined intracranial, extracranial approaches, and watch Tessier operate. Then in the early 70s, Dr. Tessier came to the United States and visited many of these institutions, visited HUP, visited Toronto, visited Mexico City, visited Miami, and again did these very arduous cases in the early years of craniofacial surgery. And here you see a list of many of the first-generation craniofacial surgeons. The International Craniofacial Club was started in 1972, and these are the founders. As you see here, Fernando Ortiz Monasterio on the far left, Ian Monroe next to him, the Clinician of the Year, of course, in the center, Ken Salyer to his left, and then Ian Jackson to the far right. This International Craniofacial Club morphed into the International Craniofacial Society, and here a little bit more recent picture of some of the co-founders of the International Craniofacial Club at having a good time at the International Craniofacial Society meeting in Australia. So Linton Whitaker, over 20 years as Chief of Plastic Surgery at CHOP, and nearly 20 years as Chief of Division of Plastic Surgery at HUP, an outstanding career. His accomplishments were many. I think one of the things he's perhaps most proud of is being founder of the Center for Human Appearance in Penn. He was the first recipient of the Peter Randall Designated Chair in 1997. Many Lifetime Achievement Awards, not one, not two, but 3 named lectureships in his honor, and the International Craniofacial Society Tessier Medal of Honor. Contributions, again, almost 250 peer-reviewed publications, 300 visiting professorships. Linton, that's a lot of frequent flyer miles. A few Whitakerisms, okay? Work hard. Never turn down an opportunity to present. Focus early. Learn a lot about a little, okay? Buy property in Telluride, okay? I listened and did the first 3, unfortunately not the 4th. And what about Linton Whitaker, the man? Okay, as you can see here, people like to be around him. He's got charisma. So I think it is, at least in part, this force of personality and this very down-to-earth feeling of loyalty to the team that, at least in part, has made him the man that he is. And of course, the home team, 3 generations of Whitakers. And so, Linton Whitaker, I think you need to come up here. I stand up here at this time, not alone. I stand here with 30-odd previous residents and 40-odd previous craniofacial surgeons, craniofacial fellows, to say how proud we were to train with you and how very happy we are for you on this very, very special day. We love you.
Thank you. We nearly had a crying together right up here. So, and some of that was actually true. I don't know, Jim. Jim, I've known him for 40 years. Okay. I've known him for 40 years this year. And like right now, he's always been outstanding and without question, one of the best. He was the 2nd craniofacial fellow, and they don't get any better than Jim. And I want to take you briefly through why this is so extraordinarily special to be standing up here today. Not only this great honor, but my family started with the first settlers of Texas. This is a book. It's, you see on the first colony of Texas called the Old 300. On my mother's side, Chester Gorbett came from Pennsylvania. And in 1824, with Stephen F. Austin, was given a league of land on the Brazos River, which is part of that ranch that you saw in the slide, still in the family, 6 generations later. And Chester Gorbett was an incredible ancestor. I wish I had time to tell you more about him. But you see at the bottom right in that slide, I have 6 generations of ancestors buried in Martins Prairie Cemetery over near Keith. And I think there may be another part of the family heading in that direction at some point, but not too soon, I hope. So I grew up on Enfield Road in Austin. You see in the upper left-hand corner, and that's my oldest son. And that's why I was saying about 1976. It certainly changed around it now. And in the bottom on the map, you see the star where the Marriott is today and where my father's business was, the Capital Paper Company. It was a paper recycling business, which I think there were very few of in the country. So this was my turf. I played, in fact, where this building is, there was a hunting fishing store that I used to frequent a lot when I was a teenager. And so my dad's business was about 2 blocks from where we stand today. And then I went on to Austin High School and then to the University of Texas. We didn't used to have to say at Austin. It was the University of Texas. Now there are a whole bunch of them. And then I graduated from there in 1958, had 4 more stops along the way, and then finally landed in what has been exactly the right place for me at Penn and Philadelphia. And today, full circle, back to here, from Austin to Austin, full circle. So I want to just say how much I have loved being at Penn and in Philadelphia. It's been really a privilege to spend my career in this extraordinary place with quality and history at every turn. And thanks to Joe Cerletti, who determined these factors, I have an office with a magnificent view, as you can see there. So, I have had the great privilege of working at 2 of the finest medical institutions in the country, the Hospital University of Pennsylvania that you see in the upper left, which was the first university hospital in America, 1874. And on the right, the Children's Hospital of Philadelphia, which was the nation's first children's hospital. There's a book called Philadelphia City of First, and it's a long list. So my thoughts about this honor, this title, I haven't done any clinical work for 7 years, so I think it's the clinician of yesteryear. But I will give you a few examples to respect this award and the title and some of what got me up here on the podium today. And I'm going to talk about appearance because it's so dominant in everything that we do. And I want to give a few credits because I've used parts of or some of their slides. And two of these people are here today, Jesse Taylor and Aaron Warman, and I'm grateful for all of them. So this is the theme, the center, the centrality of my talk. Appearance, our centrality. And it's been such a dominant factor in life and in history. And the ancient Greeks believed a person's outer beauty reflected his or her grace, moral fortitude, and strength of mind. But I see beauty as a code word for sort of the ideal normal. And you see on that spectrum below, beauty is something it's a difficult word, and I think glamour or something I attach to that. Ideal normal is what I think the Greeks and everybody else was talking about for the most part. And historically in surgery, most of this crowd knows these people and the ancestry they bring, but that was all about appearance too. Noses that were chopped off were restored, not because it was a functional necessity. And Sassrita and the Brancas in Italy, and Tagliacozzi, and then finally the German surgeons in the late 1700s, Graf, Diefenbach, Langenbach, are the real beginnings of modern plastic surgery. And again, another sort of Philadelphia Penn starting point. John Matar is regarded as America's first plastic surgeon. He was a graduate of Penn in 1809 and is credited with performing the first operation for cleft palates in the Western Hemisphere. My foundation and the foundation on which Penn Plastic Surgery is built dates to Robert Ivy, who was instrumental in the founding of this great organization today, as well as multiple others, the American Board of Plastic Surgery, the second editor of the journal, and in a sense the first, because the first editor really died, I think it's around 6 months after becoming editor. So Dr. Ivy really molded that journal. And he was had a dental degree from Penn as well as an MD. And so he had very much a facial skeletal orientation, which carried on to me. And he was the founder of the Pennsylvania Cleft Palate Program, which was the first such multidisciplinary program in the country dealing with these complex issues. And I based that idea on founding the Penn Craniofacial Program in 1972, this multidisciplinary approach to complex problems. And then subsequently, something I'm going to talk more about, the Center for Human Appearance. And I was somewhat astounded and proud and pleased. This book that was published in 2015 on the 250th anniversary of the nation's first medical school, there was a little blurb about the size you see on the right. Remember, it's 250 years, so to get a little blurb in there. And it describes the Center for Human Appearance. There were an awful lot of institutes and centers at Penn that were not mentioned. So what is this? Edwin and Fannie Gray Hall provided the foundation of funding that makes it viable to this day and makes people want to be part of it. It was the first such center, academic center, that focused on the centrality, the importance of appearance. And in fact, when I was trying to establish this, there were people who said to me, appearance, especially in a tradition-bound place like Penn. And so that was 1988 that it was founded, and we got the money to really make it sing in 1994 from the Hall Trust. And it comprises 6 traditional specialties that are cooperating in a sense that they don't always nationwide, plastic surgery, derm, ophthalmology, oral surgery, ENT, and psychology, about the physical and psychological aspects of everything to do with appearance from birth through old age. And then there's another component to this that I've called beyond traditional, And these are other endeavors that significantly are impacted by appearance, as is everything in life. The objectives of the CHA are advancing treatment is a big issue, but really promoting awareness and understanding of the importance of appearance. And basically, we do this through education and research in all aspects of appearance. So beyond traditional, and I'm going to spend a few minutes talking about this because I think it is a rather unusual aspect of the program. And I'm going to talk about the first two in a little more detail, so I won't mention them here. But the Wharton School, impact of appearance on business, the veterinary school, the important impact of what happens with the relation of kids and animals, unfortunately not enough time, and with an international art studio in Cominante. So beyond traditional, Sharona Pearl is part of the Annenberg School of Communication at Penn. And for example, she's presented several times and we interact some with her. Most recently on February 14, she talked about the packaging of face transplant recipients. And she's written or edited 3 books on how appearance matters in communication. She's a PhD that deals with communication. The second part of the CHA that I want to talk a little more about is Anjan Chatterjee, who is head of neurology at Pennsylvania Hospital, part of the Penn constellation of hospitals. He's a cognitive neuroscientist at Penn, and he has attempted to understand the factors that shape how we perceive beauty and aesthetics. And my commentary is that we human beings are constantly seeking beauty. It represents harmony, achievement, health, such as in a beautiful speech, building, automobile, surgical procedure, et cetera, et cetera, et cetera. So I can't spend time on detail about this, but the areas that light up, Chatterjee in the Journal of Cognitive Neurology in a study showed that the brain responds automatically to attractiveness. You can't help it. This functional MRI shows that there is no significant difference in response to both facial attractiveness and the attractiveness of place. In the next one, what he showed in another functional MRI, that the same areas light up once again. There's an automatic response to beauty even about people that you're just trying to identify. There's a greater response to someone you're trying to identify if there's attractiveness involved versus non-attractive faces. And other authors have written about this, as Chatterjee has pointed out to me. The beauty is good stereotype assumes that attractive people possess socially desirable personalities and higher moral standards. And this is shown up by, as you see in the top center, a person trying to rescue an abandoned dog, and on the left, a person who's attractive, about attractiveness judgment, and both light up the same in our brains when you're presented with those two. So that beauty is goodness. That's how we human beings respond. And in business, on the upper left, Wendy Steiner, who's professor of English at Penn, has written extensively about the reality impact of appearance. And Nancy Etkoff at Harvard has written about the beauty premium is in our biology. Dan Hammermesh, here at the University of Texas, Austin, has written in the American Economic Review that earnings, if you're attractive, you have an edge. The beauty premium is a plus 5%. The plainness penalty is a negative 5 to 10%. And this is equally important in both males and females. A Princeton psychologist, Todorov, looked at hundreds of congressional races and predicted winners with 77% accuracy by rating pictures. Voters perceive baby-facedness as signs of incompetence. Facial maturity/strength connotes capability. So, with that background, which I think is pretty convincing evidence, I will explain a little bit better maybe why I'm up here, besides knowing Jim Zins for so long, that my surgical goals were almost never beauty. The ideal normal, that zone, just above normal and below this thing called beauty. Ideal normal or enhancing normal was the goal most of the time, and in children, mostly was about normalizing defects. And I think to be clinician of clinician of the year, my most important clinical contributions are listed here. Started the craniofacial program at Penn, one of the first in North America, and then the next two I'll talk briefly about. And this was, I believe, the first paper published in Plastic and Reconstructive Surgery. And the author on the far right, Larry Kerr, was the only person preceding Jim as craniofacial fellow. And we call this isolated craniofacial dysostosis at that time, but we would call this unicoronal synostosis now. But that was published in 1977 in PRS. And here's just one example. In the bottom, you'll see some scales coming up. And you see that child on the left has on the patient's left unicoronal synostosis. And it was a mild deformity, but it's on the mild edge of the deformity scale. And I've crossed out beauty because we're not seeking beauty. And I think on the post-op on the right, you see that we're right in the middle of normal with that. And that's what we're after. The second area that I think I had very early beginnings with this whole field, something I called interphase surgery, the convergence of aesthetic and reconstructive surgery. The phase where you're basically dealing with a skeletal structure more than had probably been done in as comprehensive way in the past. And one of the earliest papers on this was Facial Skeletal Contouring for Aesthetic Purposes, published in PRS in February 1982. And I presented that, my early works with that, at the Aesthetic Society, and that little trophy on the left one I was proud of. I was awarded Best Presentation at the Aesthetic Society in 1983, shortly after that paper. So a few patients to illustrate that transition from birth defects or deformity to the range of ideal normal. And the scale at the bottom again, this is a patient with probably a microform of Crouzon's who has a relatively mild deformity, the upper limit of what you would call deformity, but on the right, I think we've gotten to the range of ideal normal. And you can see it a little better in this profile. She had a mixture of true craniofacial frontoorbital advancement, but then she had a sliding genioplasty and malar implants too. So she went from upper edge of deformity to the ideal normal range. Trending a little more toward the cosmetic, but still on the reconstructive type. This is a patient who had a temporal reduction, malar augmentation, reduction, genioplasty, rhinoplasty, as seen on the left, and I call this sort of a bottom edge of normal, and on the right to achieving into that range of ideal normal. And now to the purely cosmetic end of the spectrum, applying some of these principles, and again emphasizing this ideal normal range from just at the upper edge of normal to something that's slightly less than beauty, perhaps. This patient illustrates that. I would say she was in the bottom edge of normal because of the very prominent and laterally projecting malars and the recessive chin. So she had zygomatic reduction and sliding genioplasty, putting her into that range that we're talking about. And a second patient, again, a little on the left, basically in the normal range, no question. So this is cosmetic surgery. She had malar augmentation, posterior mandibular augment, and secondary rhinoplasty. And from normal and well into that range of ideal normal. And a final patient who had what I would call basically definitely in the normal range, and taking this patient to the upper edge of the ideal normal with a mandibular angle reduction and sliding genioplasty. And you see the mandibular angle reduction as well as the genioplasty best in this profile. So there's nothing new in my message, but it's been known for a long time about great philosophers and thinkers. And there was nothing, Aristotle agrees with the premise of what I'm saying today, and Tolstoy. I hope they were talking about the ideal normal and that thing called beauty. And everything I've ever done, Everything I've ever done could not have been done without her, Renata. 53 years together. And then you see her in 1963, and probably why you can understand why I said, "Who's that?" when she came down the stairs. And then the pictures with gaps of years. So I'm back to my other home here, and I think everybody needs to know how to do that if you haven't learned. And then my home base in this great city and that great city and institution where I've worked. And with this sunrise, that's not a sunset, sunrise on this magnificent place. I thank you very much for your attention.